Greetings. Let us talk about monopolar and bipolar devices used in electrosurgery. And these are my acknowledgements. And today's learning objectives include the following. We will learn about the principles of monopolar and bipolar electrosurgery and how to go about setting it up. When you think about monopolar devices, these are commonly used in GI endoscopy, and these could be a heart biopsy forceps, a heart snare, APC, and hemostatic forceps. All of these instruments, when you use, the setup is exactly the same, and we will go over it. One thing that is important in electrosurgery is to make sure that you have your electrosurgical unit right in front of your eyes, not hiding behind all of you. It's very important to keep it right in front so that we can check what parameters are being used before we deliver the current. So, important to make sure to bring the electrosurgery unit right in front of our eyes. That is the most important thing to keep in mind. Otherwise, physicians can deliver the wrong current to the patient. So, before we deliver current, we want to check and make sure the parameters are what we want and deliver the right electrosurgery current. We've learned about the electrosurgical circuit, and let us talk about the dispersive pad. That is the dispersive pad. So we place it in GI endoscopy, especially for either EGDs or colons. We place it on the right loin, and in patients with ERCP, you may place it on the back in the loin, in the lumbar area. It is best to place the dispersive pad very close to the site of surgery, not far away, so that the electrical circuit could be completed much faster without the need for a longer range of travel of the current before it gets back to the circuit. What are the do's and don'ts about placing a dispersive pad? One, you should avoid placing it close to a pacemaker or a defibrillator or any other electrical generator. That's very important to do. Number two, avoid placing it over a tattoo. Avoid placing it over a very hairy area. Avoid placing it over a bony point. Avoid placing it over an artificial hip. These are some things one needs to keep in mind. You should pick up an area where there's a lot more muscle and put it over there. And also avoid putting it on a medication patch that is attached to the skin. The dispersive pad allows the current to be distributed back to the generator over a wider area, and having a good contact of the entire pad is critical. Otherwise, skin burns can happen. A faulty dispersive pad can create a big skin burn. So it's important to place it right. So now that you have the circuit complete, as you can see here, we've learned about the electrical circuit, starting with the generator, creating the voltage. From there, the monopolar electrode takes the current to the snare, which is a monopolar device, and from there to the tissue, the stalk of the polyp, and from there to the dispersive pad or the returning electrode. It is not a grounding pad, it should be called dispersive pad, and then back to the neutral socket of the electrosurgical generator. As you can see here, the main purpose of the dispersive pad is to distribute the returning current over a wider area so that the temperature doesn't increase there. So something very important to keep in mind. And it's important that the dispersive pad is attached completely throughout the entire surface, not a small area. Then there is concentration of current there and there's going to be a skin burn. We should avoid that. So let us look at it. Okay, here is my electrosurgical generator. I set up the program. On the right side, you have 3 sockets, a bipolar socket, monopolar socket, and a neutral socket for the returning electrode from the dispersive pad. So, first attach the dispersive pad to the neutral socket, electrode socket, and then attach the snare to the monopolar socket. So we have now the circuit ready to be activated. And let us see, here is a polyp, and I want to show you a short video about how the polyp is removed. Here is a snare. We injected fluid underneath the polyp, lifted the polyp away from the muscle, and we are entrapping that polyp and tight so that the current density is high so we can have a clean cut. In order to achieve the clean cut, we press on the yellow pedal and it will generate the current, and that will heat up the tissue fast, and it's a nice clean cut. There's no charring, not much coagulation. So we've learned about monopolar device setup, right? And if you do a heart biopsy forceps, it's the same setup. If you use an APC, it is the same setup, except that with APC catheter, you blow some argon gas as well. And if you use a hemostatic forceps, it is the same setup. If you use a monopolar sphincterotome or a needle knife, it is the same setup in terms of how you set up the electrosurgical unit, monopolar electrode to the snare or whatever device, dispersive pad on the patient, and back to the neutral electrode on the electrosurgical generator. Now let us go to bipolar device. Bipolar devices is that is commonly used is a multipolar probe or bipolar probe that is used for hemostasis, for bleeding ulcers or arterial bleeding. Bipolar devices, other examples are radiofrequency ablation devices that are used for treating patients with Barrett's esophagus. So here is a bipolar device and a bipolar circuit. In the monopolar device, the circuit goes from generator to the snare, through the body, dispersive pad, and back to the generator. In bipolar system, generator sends current through the cord to the device, and then it goes back in the reverse direction. Not in the reverse direction, it goes back, the circuit is completed in the same device back to the bipolar socket. You do not need to place a dispersive pad when you're doing a bipolar probe. You do not need to place a dispersive pad when you're using a radiofrequency ablation device. That is a bipolar device. So let us see how to set up. There are 2 ways to set up. One is you can use your electrosurgical unit that has a bipolar function as well, or you could use a dedicated machine with a bipolar function, specifically just bipolar function. So let us see this. This is a patient who has bleeding ulcer, and you have the bipolar device, bipolar setup that you picked on your machine here, and you attach the probe, the cord to the bipolar socket, not to monopolar socket. It has to go to the bipolar socket, and then hook it up to the bipolar device. And then you can actually activate and create the coagulation effect. And this device has a couple more functions not related to the electrosurgery. One is you could inject epinephrine, or you could flush and clear the blood with another syringe, right? Those are the other outlets. And when you're ready, you activate the bipolar probe by pressing on the blue pedal, that is for coagulation. And press on the blue pedal and apply the probe to the vessel firmly to create what is called coaptive coagulation. That means you apply the pressure so that the vessel wall kiss each other, so that when you apply current, you basically obliterate the vessel. So we've learned about how to use a bipolar device in an electrosurgical unit. Here we are looking at an OB machine. How about bipolar device in a dedicated machine? And here is a dedicated machine. This is from Boston Scientific. And you have a bleeding vessel there. You have your bipolar device, and you attach it to one cord goes to the bipolar socket, and the other catheter goes to the flushing, automatic flushing outlet. And you could actually apply the current and treat it. So we've learned about how to set up monopolar device, which is most commonly used in every endoscopy unit every day. And we also talked about bipolar device, especially for bleeding ulcers or for Barrett's esophagus. The difference between the two is for bipolar, you don't need a dispersive pad. And remember, when it comes to dispersive pad, you have to be very careful in applying close to the site on a big mass of muscle, away from bony points, away from tattoos, away from the hairy areas, away from any medicinal gels applied to the skin. Thank you.